Hi pals, it's me, Artie, they them pronouns only, and I thought that I would basically make the video version of my introduction to Takayasu's blog post. It was a blog post that used to get quite a lot of hits when I initially posted it, when rules in different social media platforms were different to what they are now. You were allowed to share links more often, you were allowed to self-promote more often, whereas since that's become less and less acceptable and more often against the rules without any kind of grey area or nuance of like, well, as long as it's relevant to the topic of this page or this group or blah blah blah. A lot of my videos generally now don't get shared among these places, same with my blog posts, so I still feel like creating both video and written format for things can help make it a bit more accessible to different people. So if you prefer to do your research reading, oh my god, my brain is just like not here. If you prefer to read this kind of information, I will link that blog post. I'm pretty much going to use exactly the same points, all the same references that I've included in that blog post. So as well, if you want to see more of the original sources, feel free to go to the blog post and have a look at those hyperlinked sections. So basically this video is kind of just talking about what Takayasu is and kind of those early steps and stages in diagnosis and treatment to try and help explain things a little bit easier. Some of the things that you find online can be a little bit terrifying, basically, or they can sound terrifying if you don't know how to interpret statistics, for example, or how to read annoying medicalized scientific language. I did find that this original blog post did help a lot of people, especially early in their diagnosis or people who were loved ones of fellows Takayasus havers. So I just wanted to give all that work that I did, because it was like 3,500 words and a lot of specific resources. I wanted to just give that piece another boost for life and use it here to share in another format. Ironically, I am wearing the same shirt as the video I made around the time I was diagnosed with Takayasu's, unknowingly. My first video about Takayasu's, where my doctor didn't believe me. So I'm not going to rehash all of that stuff. If you want to know specifically about my personal journey, that's the majority of it in that video. So one of the first things I want to say is that most people, I don't know why, refuse to work out or learn how to pronounce Takayasu's properly. They see an Asian name and kind of just give up, which bothers me as a patient with Takayasu's, and I'm sure probably bothers Japanese people because the name originates from a Japanese doctor, but it's really not that difficult. It is Takayasus. It's also arteritis because it's the arteries, not arthritis like joint inflammation. Arteritis, which is another thing that even my doctors get wrong. Actually, a lot of my doctors get both of those things wrong. So Takayasu's arteritis is a rare type of vasculitis that causes large blood vessels to become inflamed. So that's usually mainly arteries involved, which is why it's arteritis, but it can also affect the medium size blood vessels. It most commonly damages the aorta and is often seen in the aortic arch, and the main branches off of the heart basically is usually where you will see mostly narrowing, but also aneurysms. The aorta is the large artery that carries blood from your heart to the rest of your body. Takayasu's is also known as the pulseless disease or aortic arch syndrome. I don't really see many people referring to it as either of these things these days, but like, I understand why these terms were used. Like I said, it's often the aortic arch that's affected, but also a lot of patients end up becoming pulseless in mostly their limbs, but also sometimes other locations. So like I'm almost technically pulseless in my right arm. Takayasus can lead to narrowed or blocked arteries, which obviously lessens or completely cuts off blood flow in that direction. At the time of writing the blog post, I technically had 2 areas of narrowing that could be seen. As of January 2024, I believe it was one of the branches off my heart. I always forget what those arteries are called, but it was the one going to the left side of my body that was showing some slight narrowing, but as of January 2024, it does not appear to be looking any kind of abnormal, so it may have reversed. However, I do still have a narrowed artery here in my right arm, and this is the brachial artery, and it is somewhere about here basically, and that's why my right arm has little to no pulse. It can also lead to weakened artery walls that can bulge and tear, which is called an aneurysm. Before I was diagnosed, I thought an aneurysm was something very different. I think TV does not help with that. The way that a lot of medical dramas talk about aneurysms, I don't think is correct. I thought an aneurysm was something more like a blood clot / stroke. Strokes are usually caused by blood clots basically flying free and causing damage that way. However, with aneurysms, it's more that the actual walls of the blood vessels tear and open. Both bad, both suck bad. Takayasus can lead to pain in the limbs, particularly the limbs that are pulseless or on the receiving end of less blood flow. It's most commonly in the arms. You can also have chest pain, high blood pressure, and even things like heart failure, heart attack or stroke. Since joining some of the online communities for people with Takayasus, I found that many people were not diagnosed until after a stroke or until after needing some kind of life-saving heart surgery. If you watch my video linked that I mentioned earlier about my diagnosis story, you'll see in many ways that I was very lucky to be diagnosed before something worse happened. However, not before pretty much permanent damage was done to my body. However, as well, of course, as specialists and experts in Takayasus continue to study Takayasus, continue to treat Takayasus patients, they do learn more and more, and I believe it is being caught earlier than the most extreme circumstances such as strokes, heart attacks, heart failures. I think more and more people are being diagnosed in that sort of in between vague symptoms beginning and that extreme circumstance. Many, if not most patients need medications to control the inflammation caused by our immune system attacking our body tissue to prevent complications or further damage being caused. There are 2 main stages that they talk about for Takayasus. Stage 1 can be close to impossible to identify, and as I was already dealing with other health issues myself for the years leading up to my actual Takayasus diagnosis in 2020, I don't think I would have been able to find this, work out that I had this like any earlier. I don't think there was any possible way for me specifically to find out I had Takayasus before the narrowing of my artery in my arm. Many people, but not all, will feel unwell with fatigue, muscle and joint aches, and also pains, mild fever, which sometimes involves night sweats as well, and unintended weight loss. For me personally, I have hypermobility syndrome and I've dealt with muscle and joint aches and pains for years and years, as well as fatigue. I never really had any kind of fever. I didn't really lose a lot of weight at any point, but I did have night sweats on occasion, but they are also symptoms of Crohn's disease, and I had a lot more clear and obvious symptoms of Crohn's disease. And as well, Crohn's is much more common to have than Takayasu, so it's a lot easier to identify and diagnose for the most part, particularly in my circumstance. It was pretty clear, and I was diagnosed with Crohn's disease literally a year before my Takayasu diagnosis. We were only able to figure out my diagnosis of Takayasu because I'd entered stage 2 already. This is a stage that inflammation causes arteries to narrow, so less blood and oxygen and fewer nutrients can reach organs and muscle tissue. Commonly, signs are weakness or pain in a limb or limbs with use, lightheadedness, dizziness, fainting, headaches or visual changes, memory problems or trouble thinking. There is a typo in this. Chest pain, shortness of breath, high blood pressure, diarrhea or blood in the stool, as well as anemia. Like I said, a lot of those are also common in Crohn's disease and other things I have going on. I've had chronic headaches as well for years. And also the diarrhea and blood in my stool was crossed off because of IBS/Crohn's disease. I've also always had a lot of dizziness, which has been contributed to my hypermobility syndrome, but also if you are a regular viewer, you know that I am also trying to get through the process of working out if I have dysautonomia and what type. Most likely POTS, but also at this point, they're just doing their own thing. They're just vibing. Anyway. And also my blood pressure has never really been that high and used to be relatively low until steroids, which you guys would also know if you are a regular here, because I've made numerous videos talking about being on steroids because of Takayasu and the high blood pressure it has caused me. The only symptom I could actually go off of from anything related to Takayasu was that my right arm hurt when I used it for anything, which is known as claudication. I think that's how you pronounce that. Washing myself, brushing my teeth, holding something, patting my dog, anything above my head, repetitive movement would set my muscles on fire, but it was often put down to hypermobility syndrome, as talked about in the video I keep mentioning, or possibly pinched nerves. But I'd had so many MRIs as well in the past, one of my entire spine, and not a single pinched nerve could be seen on there. However, I believe there are some arguments about this, that to really get a more accurate representation of pinched nerves, like in MRIs, you should do a standing MRI, which I don't think many places actually let you do. So either way, we've crossed everything else off, really. I also had nerve conduction testing, which came back completely fine. Besides this, the only other thing I had noticed is that anytime someone tried to take my blood pressure from my right arm, the machines just never worked, or like very rarely worked, but for the most part just didn't work at all. I always had to tell them to use my left arm, because for like, even though I think you're supposed to use the left arm for reasons, I know there's reasons, I just can't remember exactly what they are. I think you get a more accurate reading or something from the left arm. Everyone wants to fucking stick it on your right arm, so like I'm gonna need someone to fix that, thanks. Or like read my chart please, because I've now had this thing for like 4+ years and people still do it all the time. And also as well, before my abscess draining surgery that I had in November of 2019, I'd just been having like continual panic attacks every time anyone came near me with cannulas. They were struggling to find a vein in my hand to be able to cannulate me and knock me out for this surgery. I think they probably just managed to put it in and very quickly sedated me. I was still awake, and I sort of remember being like vaguely aware of how much the blood pressure cuff hurt on my right arm. So as well, this was like a good 6 or so months before I knew I had Takayasu as well, so I didn't know to say, hey, that's not going to help. And then I started to just lose all feeling in that arm because the cuff was squeezing so hard, and it was lucky I'd managed to get out some kind of sentence like, no, you need to put it on the other arm, it won't work, before passing out. And I woke up after that surgery with bruises all over my arm. And honestly as well, since then, a lot of the times I've done blood pressure readings, I've come out of them with like pretty intense bruising and like broken blood vessels, basically. If I can find photos I've taken, I'll add them. But like, I have delicate skin for one, but also like it does squeeze really, really, really hard when you don't have a fucking balls. Because it's like, hey, this bitch is dead. We've got a dead one here. If it can't find a pulse. But yeah, they must have swapped it over after I'd been completely knocked out when they realised it wasn't doing anything. I don't know. This is also the particular thing is what made my GP stop and think, what do you mean? I found that I was almost entirely lacking a pulse in my right arm. This isn't mentioned on all online resources, but it is on the Vasculitis Foundation's page under symptoms and diagnosis for Takayasus. Thanks to my GP, I made it to the right people and did get diagnosed. Not thanks to the person who should have been doing that, which was a rheumatologist. For some statistics, Takayasus, also known and called TAC, or like referenced as TA in writing, is often diagnosed in women, AFAB people. You know, it's most likely to be found in women, 9 out of 10 patients to be specific, but I have also come across, you know, some men, some cis men who have it as well. And usually it starts or is found between the ages of 15 and 40. Obviously there are outliers to that as well, but that's usually the average time it will start causing problems. It has affected people outside this age bracket, like I said, but this seems to be the most common time frame. It also is more commonly diagnosed in Asian people, and one study also specifically says in Latin American people. I think some of these statistics are a little bit unclear. We know there's a lot of reasons why certain marginalised demographics don't go to the doctor or aren't diagnosed because of unconscious bias. I feel like there could be a heavy leaning towards most commonly being diagnosed in Asian people because it was first officially found in Japan by a Japanese doctor. However, it seems to be that quite a lot of people across ethnic groups and racial groups can get it. I don't think it's really specific to any sort of race or ethnicity. I have also seen a few different estimations on how common this disease is, but the Vasculitis Foundation and rheumatology.org, at the time of writing this anyway, stated 1 in 200,000 people. This leaflet as well, that I will link below, says a UK study showed that Takayasu affects 1 person per million per year. And this is likely just a statistic for UK people. It is also said that 2 out of 10 people with Takayasu get better after 1 episode or flare-up and do not require long-term treatment. It is currently understood to be an autoimmune disorder, which occurs when the body's natural defense system mistakenly attacks healthy body tissue for something it needs to get rid of, pretty much. It is not thought to be genetically inherited, but there is something thought to be within genetics and DNA that makes Takayasu more likely. Takayasu was first described by Dr. Mikito Takayasu in 1908, which I found out as I wrote this. There is a source in my blog post that is more about the history of Takayasu, if you want to learn more about that specifically. There's not really a lot about it that can be found, but for people who find videos more helpful for learning information, there's also a webinar version by the Vasculitis Foundation on Takayasu. I can't remember if that's just a general one or whether that's on the history. Diagnosing Takayasu is difficult as it shows differently in each patient. Vasculitis.org.uk has some really useful information about each different kind of scan, as well as the images, so I can recommend checking that out for anyone who wants to learn a bit more about that. Not everyone will have a raised inflammatory marker in their blood tests, so like ESR or CRP, and they also tend to have different names or like shortened names depending on where you are, either in the country or in the world. So they might be known as a different thing, but it's the same thing probably. And not everyone as well will show active inflammation on a PET CT scan. The most accurate diagnosis technically is a biopsy, but it is very risky to do on such large vessels, especially at the aorta, and is not usually done unless the patient is undergoing some kind of vascular surgery. In my regular physical exams, my pulse is manually checked and listened to all over my body, and I will have you know that my left foot has a great pulse. I know. But next to none in my right arm. Like, you can still feel it, you can still hear it, but it's very faint. But also as well, I've found that my own vascular system is smaller than average, which might be part of the problem of me struggling with blood tests, as well as people struggling to find and feel my pulse generally, because my vascular system is just much more small. I don't think that's technically anything related to Takayasus. I think that's just unfortunate family genetics. I've got a few family members who have a similar problem. But this is where the name the pulseless disease comes from, because the blood pressure and heart rate are different across limbs depending on how much damage the arteries leading to them has sustained. 90% of patients will experience one or more arteries narrowing and rendering their limb pulseless or nearly pulseless. They also listen for sounds called bruits, I think is how it's pronounced, but it's spelled bruits, so I think it's bruits, which can be heard over large arteries. I think they usually will listen over like sort of your chest area and your neck with a stethoscope. As far as I know, I do not have bruits. I think I've been told that every 6 months at least for the last 4+ years. You often need multiple kinds of imaging scans done for diagnosis and to find the extent of the damage that has been done so far. An ultrasound can find narrowing in limbs and in the neck. MRI/MRAs with contrast can find narrowing in the aorta within the body, and a PET CT is for active inflammation but doesn't really tell you much else. It's just if there's still active inflammation going on, doesn't really show you the extent of the damage caused already. And a PET CT requires radioactive sugar water to be injected intravenously for that scan to happen. It's a weird thing. They put a little tap on because they can't just put all the radioactive sugar in, so they go between radioactive sugar and just saline back and forth until they've got everything into you and you're not allowed to do anything. That's also not great as well for your body and your health, so a lot of doctors tend to limit things like PET CTs and generally use CTs because of the radioactive and radiation stuff. Not good for you, basically, especially if you're diagnosed young. If you're a bit older, they're sort of like, oh, it's okay. That's what they said to me anyway. There are a few other scans, but I'm not entirely sure what they are or how they work, as I've not had them done before. There are more details on the Vasculitis Foundation site under diagnosis, but also on the Wikipedia page on this. It can be helpful for people totally new to healthcare, as it links many key terms to help with understanding like the basics of testing and body parts. When it comes to treatment, there are a few options, but the general goal is to decrease inflammation as soon as possible and sustain that decreased inflammation. Often that means suppressing the immune system, so the disease slows or stops progressing. Many people have to take steroids and find it difficult to fully come off them as their inflammation rises and their symptoms return. So when I wrote this, I was on month 9 of being on steroids, and I'm now like 4.5 years or more. Yeah, so I am currently still slowly tapering down, just as I say in this blog post. As I've said a million times on my channel, steroids are not a fun drug to be on, especially long term. I've made a few videos on my experiences of being on steroids, both like early on in the short term and then being on them longer term. This is the longest time I've been on steroids. The previous times were for Crohn specifically and were only like 1 to 3 months at a higher dose. Another medication family that's often used is immunosuppressants. They suppress the immune system like steroids but have less side effects and are preferred over steroids. Well, they have different side effects to be honest, and a lot of them mainly come under the family of chemotherapy drugs, and this includes methotrexate, often used for arthritis as well and other autoimmune conditions. You can have it as an injection or a pill, azathioprine or mercaptopurine. You guys know I've had my experiences with those. I'm currently on azathioprine and they are both in tablet form, and also things like my sulfonylate mofetil. I have no idea what that is. The third family of drugs is also biologics, which I am also on to suppress the immune system. Again, but apparently those with severe disease who don't respond to traditional treatments may be prescribed biologics, which I think is quite an old quote. I think it's relatively common for people to be on biologics now for takayasus. The least likely, I think, is if you were on methotrexate. That one, especially as it's an injection, can often be used more by itself than the other drugs really. It's quite rare to have takayasus or Crohn's and just be on something like a chemotherapy drug and not also a biologic of some kind, as the biologics tend to be more effective overall. Also with my situation, I'm quite complex with multiple autoimmune issues. I think I had less choice anyway of what options I had, what medications I could choose. Biologics are complex proteins that target certain parts of the immune system to control inflammation. Commonly the main go-to for takayasus. Also, this is different country to country, so keep that in mind too. The main go-to I think in the UK is tocilizumab. Also, people say these names in so many different ways, so that's just how I'm going to say it, which I was almost put on, but is rarely used for Crohn's patients due to complications that have been commonly associated with Crohn's patients taking tocilizumab, which I believe was gastrointestinal bleeding. So I can't really go on that one. Infliximab is also a very common one because I think that's probably one of the most commonly used biologics generally for different autoimmune conditions. Very commonly used for Crohn's patients as well. But I was put on adalimumab injections because, I mean, I was diagnosed with Crohn's first, and I think I literally started those injections maybe like 2 months before I was diagnosed with takayasus. But you can find out more about my experiences with adalimumab in my other videos I made. So we just decided to keep with the medications I was put on for Crohn's to see how that went, because at the time it was the adalimumab. Initially every 2 weeks, which then shifted to every week, and then I was also on 25 milligrams of mercaptopurine. And as soon as I was diagnosed with takayasus, after my PET scan and they saw how much inflammation there was, I was put on high dose of steroids, and I'm still there. We're still going. We also changed my adalimumab injection brand from Imraldi to Amjevita, as apparently my rheumatologist had been doing some reading of research and found that apparently takayasus responded better to the specific brand Amjevita rather than Imraldi or other brands of adalimumab. I don't know. That's just one of the many studies that have been done.
The only difference really is that now I will be changing onto a different brand, one of which I've never heard of before, just another biosimilar brand. Even though the reason why I was changed from Imraldi to Amjevita was because of my takayasus, my local rheumatologist has signed off on this, saying that it really doesn't make a difference. So, you know, either the science has evolved and updated, or my doctors care more about the cost of the injections. So, yeah, I don't know. And I haven't started that yet, and I don't know when exactly I will. Maybe probably my next round of injections when they're delivered.
Some people as well will also need drugs to lower their blood pressure or to thin their blood to help reduce the risks of blood clots. The other option is surgery, which is reasonably risky. If you have surgery with active inflammation, it is likely to not work permanently or even long term, and possibly will occult/block again. But many people have to have surgery because it is life or limb threatening. I have been told that if I start to permanently lose feeling in my right arm and it starts to look weird, you know, like changing in colour of the skin, like yellowy, translucent, because there's no circulation, I need to contact, well, at the time it was to contact my vascular surgeon, but now it would be to contact my Takayasu specialist, because I have not seen that surgeon guy maybe since the first year of being diagnosed. And when he found out I didn't want him to cut me open without a second opinion from a specialist, yeah, I haven't heard from him since. Not had any kind of checkups or anything, so cool. But it would basically be emergency surgery to save my arm. Surgeries can also repair aneurysms. There are also revascularization surgeries where a blocked artery is bypassed, usually with like a vein graft from somewhere else in the body, usually a leg. if it's an upper arm that needs surgical intervention. I follow somebody on Instagram who has had that surgery, so that's also linked. Her name is Susana Ramirez and she's from Spain. There are also percutaneous transluminal angioplasty PTAs that aim to open narrowed arteries by inserting an inflating balloon to stretch the narrowed section, which I think Susanna has also had in the past. The vasculitis.org.uk site has a lot of really detailed information on that in particular, which I have found has not really been as detailed on other websites. So if you need to look into that one, that's the site that I recommend. But also the Rare Diseases site has some information on clinical trials as well for medications and takayasus, which usually, for the most part, I don't tend to qualify for any kinds of clinical trials because I have more than one condition, which is very annoying. There's definitely some trials I'd like to do or try, or like, you know, have the option of trying to be a participant of, but I can't because I have more than just takayasus. I kind of get it, but also it is annoying because then we never have any data on what happens when you have multiple conditions. And as I said a million times, when you've got one autoimmune condition, you're more likely to have more or develop more. Like I have, I think, at least 3, if not 4, maybe 5. I'm not quite sure yet. We're waiting for the diagnostics for that one. But as well, due to the nature of these kinds of medications, there are things you have to be careful of and keep an eye on. You know, lowering the immune system can make you more prone to contracting colds and flus and COVID, which is why I have to be extra careful during the pandemic, which is still happening, as I am more likely to catch it, but also I'm more likely to have complications that will be life-threatening. There is potential for bone loss as well, especially with steroids, which is why I have spoken to an NHS dietitian, and now, I mean, I'm not very good at actually taking this, but I at least know I should take a high dose calcium vitamin as well as vitamin D, as vitamin D helps the body to absorb calcium. You need regular checkups with your doctors to keep an eye on things. You also can become anemic, which I was briefly the year before I was diagnosed with Takayasu for about 4 months. I was on a prescribed high dose of iron tablets. We are also recommended to get the flu jab, pneumonia vaccinations and or shingles vaccinations, as this helps reduce the risks to us. But we cannot take live vaccines because I don't know the exact specifics as to why, but I remember there is a reason and I remember that I'm not supposed to take them. So it's been a while since I've really looked into that, but it's a very easy answer to find. So if you want to travel somewhere that often needs a live vaccine before you go, you do have to have a chat with your doctors about this. I have not needed to do anything like that. I haven't gone anywhere where I require live vaccines, so and I barely leave the country. The main team for people with Takayasus are rheumatologists, who are like joints, muscles, immune system doctors basically. They are in charge of your medications. A cardiologist, which is a heart doctor, can be involved. I'm not seeing one because of Takayasus, but I will be seeing a specialist soon for dysautonomia, which I think is also reasonably common to have as well as Takayasus, as well as a vascular surgeon, which is veins and arteries. And yeah, like I don't have like a named person for that, as there has not been a need. And like I said, I haven't seen the guy who was part of the initial process for diagnosing me since the first year or so of diagnosis. That was the man who sent me for an ultrasound that found the narrowing in my right arm and really started the diagnosis process for me. I also have the rheumatologist's secretary email addresses for both my local and my specialist, which I do recommend patients either find or ask for, because that tends to be a faster, more effective way of asking questions, sending results or whatever that's required. I also used to send my local rheumatologist research studies. I did find a research study a while ago that did show that Crohn's and Takayasus look very similar under a microscope. There is also a Crohn's vaccine being developed called the MAP vaccines in the works that is nearly ready for the public. I think maybe in the next few years it might actually be available. They've definitely done the first phase of trials. I don't know if they're on to the next phase or not. And I think this could also mean that one for Takayasus could be developed, but also things that I've been reading about some of the studies being conducted for COVID could also possibly lead to vaccine injections for other autoimmune conditions. I believe they've been looking at it for MS and stuff mainly first, but it shows that there's links in some of these conditions that could possibly a vaccine could possibly either prevent somebody from developing it full stop, or people who do have it, it could be made less severe or possibly cured from it. Who knows? But yeah, generally at the moment, the vaccine I talked about for Crohn's is not really being seen as a cure. It's more of a way of making the more severe symptoms and cases to be less damaging, which is always good. One of the less discussed symptoms for Takayasus is carotidemia, which is pain and tenderness over the carotid arteries in your neck, which is found in 25% of Takayasus patients. I have experienced this symptom on physical exertion since my mid-teens. It becomes very painful and it really makes it hard to breathe because, like, you know, as you're breathing, it requires a lot of, like, I don't know, that movement, and obviously you're trying to feed your body oxygen that it needs through your blood vessels, and it was just extremely painful that I tend to avoid too much, like the kind of cardio that they call like HIIT cardio. I don't do that. I basically have to stop what I'm doing and hold on to my neck, and it is recommended to refrain from extreme cardio like HIIT circuit training, as it can aggravate those symptoms too much, and I don't think it's great to do that kind of exercise if you've got an aneurysm as well. Exercise is recommended to continue as it can help widen narrowed arteries or encourage the development of capillaries, which are small veins which can help make up for narrowed arteries with like blood flow. They do recommend regular weight training and gentle cardio, but there isn't really any studies on that yet. It is thought that the majority of Takayasu patients will continue to have relapses of flare-ups and remissions throughout life, but it also appears that for the majority of patients, it burns out after a period of 2 to 5 years of being active. There isn't a lot of information on this, sadly, as well. Like, I don't think this is something that's really been looked into enough. I would love to know more about this in particular. When I was diagnosed in June of 2020, I had already been experiencing active disease for at least 2 years before that, and so now would be like year 6. Yeah, like now would be like roughly year 6 to 7. Year 6 or 7 since I started experiencing the arm pain. So like the more active inflammation of Takayasus. Even though I've had that neck carotid artery pain for like 15 years. I do hope I follow the trend of burning out in this capacity and not in the autistic kind anymore. Please and thank you. But I'm also aware that because other conditions I have, this may not be a reality. And I mean, either way, it's likely to be a lifelong condition anyway to monitor, to check on, and especially if the narrowed artery in my right arm is completely irreversible, I will forever have disability relating to my right arm. And I mean, I'm also very at peace with taking medication for the rest of my life for conditions. I would rather do that if it's going to help me feel well or feel better. As well, up to 25% of patients with Takayasus are unable to work due to their condition. I mean, yeah, I definitely can't work traditionally. I definitely can't work as many hours as non-disabled, non-sick people. And as well, the mortality rate is quite low for Takayasus, with early intervention in particular and careful monitoring and treatment of Takayasus helps prevent mortality, obviously. In the US and the UK, there is a 98% survival rate of 10 years. Most discussion on survival rate tends to be between 10 to 5 years from diagnosis. I assume this is because it is so rare and caught at such varying stages. It can be hard to say past 10 years basically, but also I think most studies have to end at some point, so There's also the limitations of just studies not being able to be continued for more than 10 years. Mortality as well, linked directly to Takayasus, is often a heart attack, heart failure, aneurysm rupture, stroke, or kidney failure. Kidney failure can be linked directly to Takayasus, or it can be linked to medications as well. Not everyone with Takayasus will find steroids helpful for their condition either, and due to having been on 2 high-dose short-term courses in 2019 before my Takayasu diagnosis, I could give a definitive answer to my rheumatology team that steroids definitely helps the pain in my arm during that period of time, which is a good thing. At least I had a previous point of reference, which people who are only or first being diagnosed with Takayasu probably won't have. Having Crohn's and Takayasus at the same time is both good and bad for my personal experience. Good as there are a few meds that are used for both diseases. Bad because there are meds for each of them that don't work for the other. Or worse, cause harm. Like I said earlier, one biologic used in Takayasus can cause bleeding in the colon for Crohn's disease. So I was lucky to be put on meds before being diagnosed with Takayasus. Adalimumab is often less used in Takayasus, particularly in the UK, but I think it's the first biologic used in America usually, but it has been used and not caused further harm by plenty of other people as well. We are seeing how things go. The specialist team are happy for me to be on it because they're the ones that told me it's usually the first one used in America. That's the annoying thing about treatments across the world, is that they vary mostly just because of their own specific research requirements. A lot of countries are required to do their own research before they can okay treatments, even if other countries have done a bunch of research on the exact same thing already. It's very irritating. Aspirin is also something that's commonly used in Takayasus, but for me, having Crohn's disease, I definitely wouldn't be able to take it because it is a non-steroidal anti-inflammatory drug, and that's something that is anecdotally understood to aggravate Crohn's and cause inflammation and bleeding, though there is not a lot of official research done on that. I think it hasn't really been done because it's relatively easy just to say, hey, just don't fucking take those. just don't fucking take that shit, okay? Thanks.
One of the other negatives that I would say, particularly in the UK, if you have multiple health conditions, but particularly ones that are rare and kind of conflicting, is just the inability for most of these teams to actually speak to each other, to work together, and to speak to you and work with you. I have had a lot of issues with this over the years, and I've made a few videos on some of those experiences, but one of those examples is that I was previously on Mercaptopurine, as I've said already in this video, and because gastro and rheumatology measure the levels differently, and also rheumatology don't use this medication as much, there were just a lot of issues with actually either giving me a correct dose that didn't make me ill, or managing those side effects, and then also continuing to manage that state of care, which is basically what led me to changing my medication from Mercaptopurine to azathioprine. I was the person who basically raised this as a suggestion or a resolution to all of the issues we'd had over the last, I think it was maybe a year and a half, or maybe even 2 years total, because my rheumatologist just was not experienced enough with this medication to understand its impacts on my health and well-being, and the gastro pharmacy team became unhelpful, to put it very lightly, and they basically were not interested in a continual working as a group, including me, long term. It seemed to be that they preferred to have a time limit on working together on this medication, so, which also is confusing to me when I was prescribed adalimumab through gastro, but somehow my rheumatologist managed to change the branding. I can't remember if she just directly spoke to my consultant or the IBD pharmacy team, but that was done much easier than anything to do with Mercaptopurine and azathioprine. So, yeah, we have a lot of work to do when it comes to that particular aspect. It really sucks when you're the patient in that scenario. Oh, and also even just the communication between the local rheumatology team and the specialist Takayasu rheumatology team, really, really bad. a lot of the time, of which I made a video not that long ago actually, because of some recent ridiculous amounts of work I had to do as a patient just to get a repeat MRA. Anyway, centralised NHS system, anybody?
And like I've said a million times, my gastro consultant said to me that once you have one autoimmune disorder, you are more likely to develop others. So even though Takayasu is rare, it isn't entirely a surprise for me to also have it. I do also have a family member that has a couple of types of vasculitis themselves. Polymyalgia rheumatica? I don't know which one it's called. And we think she may also have large vessel vasculitis, which is very similar to Takayasu's, called giant cell. And actually there are some papers debating whether they're even different things, but for the moment I think they're still considered different things, which means as well that my genetics could be predisposed to developing something similar, as it was just kind of the way the DNA was shuffled and the way it landed. Funnily enough as well, the Wikipedia page for Takayasu's actually has quite a detailed section on the genetics with linked references, so if you want to actually read more about that, I think that's something that's just a little bit above my brain capacity, to be honest. As well, as you may be able to tell, this information is spread about across like a lot of different sources. None of them say the same thing, and part of it I guess could be because of what I said about the different countries having their own research requirements. So you know, maybe the UK vasculitis pages will say a certain thing because of that, whereas American ones might say something different, or Australian ones might say something different, or Japanese ones, etc, etc, etc. None of them are the exact same. Many of them miss things from their list as well. My first search before I knew I had Takayasu's was on the NHS site under vasculitis. This one in particular mentioned painful, numb or cold limbs, which was the first time the idea of limb temperature even came up in my research. It's not really mentioned anywhere else, and I've always had quite bad circulation anyway for my hands and my feet. They're often very cold, especially in winter, and become so painful in the winter at times that it feels like I'm walking on glass. And that may also have its own link to, you know, Raynaud's disease, Raynaud's phenomenon, whatever they want to be calling that now as well. This page also recommends the Vasculitis UK site for further information, so that's where I went next. It is important to use references with good and trustworthy information for like the beginning of your journey in understanding Takayasu's for yourself or for somebody that you care about who has Takayasu's. The page that I came across as I was researching for this post in particular is by Patient Info. This is the site my GP surgery uses. Somehow, like, the UK system for the NHS is fucked. Like, I'm on so many different systems now as well. I don't know what Patient Info is anymore, but I know it's supposedly a trusted site, I think, for GPs, doctors generally. So I know it's a good one to be using. And this is the first reference to a certain pain I experienced with overexertion of my arm, a tenderness overlying the affected arteries. If I push myself too hard when weight training, I feel like over my brachial artery, which is where it is narrowed. But also as the years have gone on, I have found that different muscles are also trying to compensate for the fact that my arm fatigues and becomes really painful. So I have other muscular pain now, mostly the pectoral muscle here as well as the trapezius, because I find that the more I have to do something with my right arm, the more I'm trying to compensate with these muscles, and I often end up like really scrunching them. And that's something I don't think is really discussed anywhere either. I haven't seen it. You're welcome. But I do find that particularly like this point just above like where the elbow bends is where I feel a lot of pain from the overexertion. It also mentions back pain due to aortic involvement, which I have never read before either, and is more specific about the types of rashes linked to Takayasu's as well. Other sources have mentioned rashes but never really specifically named or described any of them. This site as well specifies erythema multiforme and induratum. I mean, I had erythema nodosum in July of 2019, which is still thought to be most likely linked to my Crohn's disease, as 1 in 7 people with Crohn's develop this, even though erythema nodosum itself is quite rare. But I have also read it can happen to people with medium-sized vasculitis, so I would love to know more about that too. Muscle wasting is also not really mentioned a lot either, but it is quite common to happen if you stop using the affected limbs. If it hurts, you're gonna be trying to avoid using it really, unless you know it's okay to kind of push through that pain. Many people compensate for the pain by using the limb less and using other limbs that are either not affected or less affected, which does lead to muscle wastage. Another reason they do encourage continued exercise as well is to keep up your muscle mass. I also know a lot of people wonder about the effects on pregnancy, and I won't lie, I don't plan to ever be pregnant or carry a child. I've talked about that in the past, so I've not done a ton of research on that, but the things I have read and the things I have heard from other people, there are lots of people who have had healthy pregnancies and babies. There have also been people who have had very high risk pregnancies and had a lot of complications. And honestly, again, it's just basically down to individual bodies and how they experience those things. There is a particular study you can check out for more information on it based in Britain, but there is also a lot of posts on the Lauren Curry Twilight Foundation site that include Takayasus. Again, I've not read any of these yet. And that's kind of pretty much the gist of the introduction to Takayasus. I've talked about a lot of the main symptoms to look out for, a lot of the main scans that people will get, as well as the main treatment courses, and linked a bunch of studies and other things too. I hope this has been helpful, and I hope the blog post can still be helpful as well for other people, because not many people have Takayasus. From my very amateur calculations, it's roughly 3,000-ish people in the world who have Takayasus at the moment, or at least I guess diagnosed maybe. And I also have some suspicions that post-COVID more people will start being diagnosed with it, because COVID does directly affect your vascular system. So if you've had COVID, especially multiple times, I definitely look out for that, because autoimmune diseases, they're not necessarily always there, and a lot of the times they can be triggered by viruses in particular or heavy stress. But yeah, I just want to continue talking about my rare disease, because I don't want it. I don't want it. Where can I return this? Where? Mostly as well, this has been talking about my own lived experience combined with research I'd done to make this blog post. And like the thing is, like I say all the time, I make these videos, I make blog posts like that because a lot of this information, even on charity websites and stuff like that, are just not accessible to the average person. People don't have time and energy or ability to learn how to understand and read medical language. I just want to try and break down some of those walls, because if it wasn't for both that GP and me continually advocating for myself, it's highly unlikely I would have been diagnosed, and it's very possible I might be instead. And like, I don't expect, every doctor to know everything about every rare disease, because that is impossible, or every disease full stop. But without a doctor who's curious, who listens, it is very difficult to get support or diagnosis for things like this. And I just want to try and help empower other people in similar positions, as it was hard for me to go through this whole process only a year after being diagnosed with Crohn's disease as well. But I definitely learned some lessons from Crohn's that I applied to Takayasus that I think at least gave me, a little bit of an advantage that other people may not have had, but also long term, not a great advantage, is it? But yeah, please consider supporting my videos generally, sharing them with people who you think would benefit from learning more about this information. I think these are good videos and blog posts to share either with newly diagnosed people or the family and friends of somebody diagnosed with Takayasus, because it's exhausting trying to talk about it every time with different people in your life, but it's a little bit easier to say, hey, here's a link. Here's the gist, babes. So yeah, I really appreciate your support on my videos and my YouTube channel. Watch my videos and share my videos, and I will see you next week. Bye.